Today I'm going to talk about the changing hospital environment and its effects on the medical device sales industry. Just to give you a little overview of what we're going to talk about, the first thing we're going to talk about is relevant textbook content, how it relates to what I'm discussing. And then my target healthcare organization is actually DePuy Synthes. And then we're going to discuss a relevant article that relates both to DePuy Synthes but also the textbook content. And then we're going to talk about potential problems for DePuy Synthes based on what we discuss in the article. And then we're going to have some questions for DePuy Synthes on how they're going to respond to this article and what steps they're going to take in the future. First of all, relevant textbook content to give you some background information. The textbook that we chose was Basics of the U.S. Healthcare System by Nancy J. Niles, was written in 2015. Niles tells us that medical devices fall primarily into the domain of tertiary prevention. This disease is already established during tertiary prevention, so the primary goal is to reduce its impact. The focus is on rehabilitation and monitoring the disease. We're past the point where we're truly going to prevent anything from happening, so we're trying to rehab the person, monitor the disease, and make sure that things aren't getting worse elsewhere. But also, if we can make things better, we're doing that as well. Many allied health professionals and non-physician practitioners are transitioning into medical device sales. This includes athletic trainers, physical therapists, occupational therapists, and a lot more. But you'll notice a lot of those, the ones that I listed, they are in the rehab setting, particularly in orthopedics. This is actually a good thing because it's going to give credibility to the medical device companies because they have somebody that is knowledgeable and when it comes to human anatomy, and also they have a vast number of clinical skills. This is also going to give them peace of mind to the doctors, hospitals, and the patients who are receiving these medical devices. Medical device is a very broad encompassing term. It can be implants, braces, stents, and a lot of other things. Biogenics are kind of falling under this umbrella now. A lot of your medical device companies are getting involved with stem cells, so that's falling under the medical device, even though it's not truly a device. If the device's implementation is invasive, meaning we've actually had to go inside the person to implant it, it is often done in a hospital or outpatient surgery center. This is particularly true total knees, total hips, things of that nature, anything where there's a chance for infection. And those two in particular are almost exclusively done in the hospital setting just because of fear of infection. Non-invasive implementations can be done in a doctor's office or a rehab clinic. This is simply, putting a TENS unit onto someone, fitting someone for a knee brace or a splint, something of that nature that falls into the medical device spectrum. Some relevant textbook content continued. Reimbursement and cost. That is something that has to be considered, especially here in the U.S. healthcare industry. Niles lets us know that reimbursement for medical devices is controlled by the Center for Medicare and Medicaid. Private insurance is often going to follow what's reimbursed by Medicare or Medicaid. They may make their own rules, but if Medicare and Medicaid are saying that this service can be reimbursed for X amount of dollars, private insurance, Blue Cross Blue Shield, United Healthcare, they're usually going to fall right in line with that and reimburse right around the same. Devices can be paid for by Medicare, Medicaid, employer health insurance, private insurance, or out of pocket. It doesn't really matter, there's a lot of options. Most of the revenue, however, is coming from Medicare and Medicaid because older populations tend to use these products more. And as we know from Niles, Medicaid and Medicare was designed to protect the elderly, disabled, and indigent. That's not saying that younger populations aren't utilizing medical devices, but typically it's your older populations that are getting total knee, total hip replacement, things of that nature. They're the ones that are going to use this the most, hence why Medicaid and Medicare are the ones reimbursing the medical device sales industry the most. Unfortunately, devices are expensive, either with or without insurance. The patient's going to have numerous doctor's fees. You're going to have an initial exam fee, then most likely an X-ray, then an MRI, and then a follow-up both before and after the surgery. And then you got to take into account the cost of the device itself, the surgery fees. You have the anesthesiologist. You have to pay the hospital back for using their space. Another thing to take into account is the hospital type. Private, federal, nonprofit, that makes a difference. Something else that's not listed here is, a lot of these invasive medical devices, you're talking about needing a stint within a rehab clinic afterwards. And some of them even having a home health agency come to your house to ensure that infection doesn't take over within the area. Some more things we can talk about is legislation and regulation. You know, One thing that's kind of helped this industry is the Affordable Care Act. It's ensured more individuals could afford to pay for their medical devices. It provided more access to health insurance, but it also created a reinsurance program for retirees who were not yet eligible for Medicare. I always think of teachers. A teacher typically graduates college at 22. They enter right in the workforce. They retire in 30 years. That's 52. They're not quite eligible to receive Medicare yet. Or let's say somebody does really well and they're able to retire early. That person's not able to receive insurance coverage as well. So the Affordable Care Act has allowed that person to receive insurance so they can get the care that they need. The Affordable Care Act made insurance cover surgery, rehabilitative services, the devices themselves, laboratory services, and chronic disease management. And really, with all those medical devices come into play. You have to have surgery to get it implanted if it's invasive. If it's invasive, you're going to have some sort of rehabilitative services. You have to pay for the device itself, but also laboratory services. If it's invasive, they need to run regular labs to make sure there's no infection or make sure that the clotting factors are right. Devices would be very difficult to pay for. Patients would have a hard time affording it without legislation that had influence on the managed care industry. NILES also tells us that all devices must be approved by the FDA. And not only does this include devices for us as humans, but also veterinary devices as well, is regulated by the FDA. Standards for all new devices and improvement on current devices are constructed by the Food and Drug Administration. The Food and Drug Administration is going to decide what standards these devices are going to be held to, and they're going to make sure that the devices are held to those standards. Another thing that they do is they're also going to track device malfunctions. This is to ensure the health of our population, and also to see if if there's a general problem. If one device malfunctions, that could be a fluke issue. But if 60 to 70% of one type of device are having issues, then that's something that needs to be looked into. And by the FDA regulating that, we're able to take a look into it and figure out what's actually going on. Diving further into legislation and regulation, the Physician Payment of Sunshine Act. This was passed in 2010 as part of the Affordable Care Act. And it requires medical device manufacturers to utilize Medicare and Medicaid providers, that utilize Medicare and Medicaid providers to submit reports annually in payments and items of value. This is really good because this is ensuring that the device manufacturers, what they say they're selling is actually what they're selling. It's ensuring that nobody's increasing their prices to an exorbitant rate, so that way we can keep the cost down, so that way people in this country can get the health care that they need. NILES also makes mention of the Pharmaceutical Research and Manufacturers of America and their Code of Ethics. They introduced a Code of Ethics governing physician and industry relations within the medical device and pharmaceutical industry in 2002, and they updated that code in 2009. This code discourages gifts and monetary rewards for physicians. I think this is actually a really good thing because it ensures that physician is putting the right device in based on him or her believing that it's the right device, not a situation that, well, I'm getting money on the back end, so I want to make sure I put this device in. he or she is really focusing on the health of the patient, and that's what the code does. It puts the focus back on the patient, ensuring that everybody's getting the best quality of care that they can. Many medical device companies have their own code of ethics that employees are required to follow. I think this is really good as well because, all of us in the healthcare industry, you know, while we do it to make a living, we ultimately all got involved because we're trying to do what's best by the patient. We legitimately want to help people. And by having a code of ethics, we're ensuring that that is what's going to transpire. Unfortunately, we can't get through relevant textbook content without talking about lawsuits. Niles defines negligence as when a provider does not give appropriate care or withholds care that results in damages to the patient. If a doctor is putting an inappropriate device in someone or an inferior device, to me, that's negligence. If a doctor's putting a device into someone that they don't necessarily need it, that's going to fall under here too. Um, Increased lawsuits in healthcare have led many to practice defensive medicine. Niles defines defensive medicine as when providers often order more tests and provide more services than are necessary for lawsuit protection. A great way to make sure you're not sued is we rule every test out under the book. Unfortunately, that can be really, really grueling for patients, and it can be very, very costly. The medical device industry itself is faced with a lot of legal issues as well. This is often going to come as a result of defective devices, uneducated sales reps, or ethical issues. Defective devices, unfortunately, that's the world we live in, that they're not always working out the way that we want them to. The uneducated sales reps, we'll dive into that a little bit more, but I really feel like this could be avoided if they had some sort of clinical and anatomical knowledge. And then ethical issues. Are we putting the right things into our products to ensure patient safety and positive outcomes? My target organization for this discussion is DePuy Synthes, and you can see their logo down below. They are owned by the Johnson & Johnson family of companies. CNN Money lets us know that DePuy Inc. was purchased by Johnson & Johnson in 1998 for $3.5 billion. Synthes was purchased by Johnson & Johnson, according to the Wall Street Journal, in 2011 for $21.3 billion, and then it was renamed. It was combined with DePuy, and they became DePuy Synthes. Some background information from DePuy Synthes' website is DePuy Synthes was actually founded in 1895 in Westchester, Pennsylvania. They develop and manufacture and also sell medical devices for orthopedics, trauma, spine, and sports medicine. They also develop surgical tools to aid in these surgeries. And actually what's interesting is orthopedics, trauma, spine, and sports medicine are actually little smaller companies under DePuy Synthes, so that way they're allowing people to focus on what is really best and what they need to focus on for their patients, but we're going to talk about them as a whole for today. OrthoWorld told us that DePuy Synthes generated revenue over $9 billion in 2016 in the United States. That's just in the United States. And I say that because DePuy Synthes can actually be found globally. DePuy Synthes employs over 18,000 people across 60 countries, and that is from their website as well. For sales, and that's what we're going to focus on because this is really about medical device sales, not so much the manufacturing part. Each U.S. state has a general manager for every area of focus. So Florida, if we're talking Florida or Georgia, there's a general manager for orthopedics, there's a general manager for trauma, there's a general manager for sports medicine, general manager for neuro, whatever focus, they have a general manager. And then each territory, which is usually divided up into counties, is ran by 3 sales reps. Now, one may be the leader of the territory, but for the most part, they're all equal. These sales employees are usually 1099 contractors, and they're going to receive a base salary plus commission based upon their performance. And each of these contracts is going to last for 1 year. But sales reps, they don't just sell the product, but they're going to advise physicians during the surgery about proper product usage and placement. These reps take a long time to learn anatomical knowledge, but also to learn about their products, how they work, what's the best way for them to be implanted into a patient for them to be effective. And, heaven forbid, one of them is defective and we got to take it out. The sales rep may be the best person with the most knowledge on how to advise the physician on how to take that out of the patient. So I selected this organization because I actually have an interest in medical device sales. I'm an athletic trainer by profession. And as I mentioned earlier, the Center for Medicare and Medicaid controls reimbursement. Well, unfortunately, athletic training, we are highly educated, when it comes to rehab, emergency medicine, concussion management, things of that nature. But the Centers for Medicaid and Medicare do not recognize us as a reimbursable entity. For that reason, pretty much everybody follows suit. We may be able to receive some reimbursement from Blue Cross Blue Shield and United Healthcare and other entities like that, but it's very, very hard. A lot of my mentors have chosen to go down a similar path. When I say mentors, I mean these individuals have taught me everything that I've known, and they're going down this path because their anatomical knowledge is valued and their clinical knowledge is valued within the medical device sales industry. And it's a very lucrative opportunity. They're still able to help people and practice their skills, but they're able to take a little bit better care of their families, and they're able to work better hours. If you know anything about athletic training, the running joke is we're overworked and underpaid. So this is just an opportunity for us to practice our skills, but also be compensated appropriately. I also like the fact that this organization can be found worldwide. I've only been affiliated with smaller organizations. While some of them may be quite large locally, they don't have a national or a worldwide presence, and that would be a huge opportunity. I also like that this company continues to grow and perform at a high level. As I mentioned, in 2016, they generated $9 billion of revenue within the U.S. With decreasing Medicare and Medicaid reimbursement, that is truly an impressive number. So the news article that I chose was titled "Hospitals Look for Ways to Limit the Roles of Medical Device Salespeople in the Operating Room." This was written by Sandra G. Boodman, and it was taken from medcitynews.com. I chose this article because I believe it has a relevant impact on the medical device industry from a monetary and a legality standpoint, and we'll dive into that a little bit further as we go along. With my desire to enter into the field of medical device sales, I have several questions and concerns after reading this article, and I'm actually very happy that I found this article and read it now as opposed to when I'm in the field for one of these companies. The first thing I want to talk about is the relevance that it has to the textbook, U.S. Healthcare Systems by Nancy J. Niles. It discusses the sale of medical devices which fall into the realm of that tertiary prevention. It's going to discuss the cost for the hospitals and surgeons to utilize sales reps in the OR. Hospitals have become more conscious of cost due to shrinking Medicare and Medicaid reimbursement. More people are insured for the Affordable Care Act, but hospitals have to protect their bottom line. The article also raises some ethical questions. The Physician Sunshine Act and the Code of Ethics created by the Pharmaceutical Research and Manufacturers of America were created to keep what is best for patients at the forefront of healthcare. So does this bring into question if somebody is actually selling something, is that always in the best interest of the patient? The article also discusses some cases of lawsuits due to negligence with device implementation, and that is a legitimate concern that I have. So I'm going to break down the article written by Susan Boodman, into the following main points. Many people were unaware of the presence of the medical device sales rep in the operating room. Until very recently, I myself was unaware of this. I knew that medical device sales was a thing, but I didn't realize they were actually going in the operating room. Physicians are often relying on the knowledge of these reps to implant the medical devices properly, and that's simply because the physician may be an expert in the surgery, but he may not know exactly how the device works. He's not trained in that, and she's not trained in that. There are concerns on who should be the expert in the operating room. Several lawsuits have occurred where a medical device sales rep overstepped boundaries in the operating room. This ultimately led to patient harm and, in turn, a negligence lawsuit. This is a major concern. If you're in the operating room, the only person that should be helping the patients are qualified medical personnel. And regardless of their back history, at that time, a medical to sales rep is not viewed as qualified medical personnel. So they really should not be even touching the patient. They can be there for guidance to help the physician, laser pointer or verbal cues, but they shouldn't be touching the patient. One thing the article really focused on was some hospitals are utilizing a repless model, meaning they're purchasing devices at a discount and they're implanting them with their own staff. Gary Bottomer, he's the chief of orthopedics at Lola Limba Hospital. He implemented a similar plan that saved his hospital $1 million each year by eliminating the sales rep and purchasing the items directly from the manufacturer. This article presents several problems for DePuy Synthes based on what it's in it. Part of DePuy Synthes' package is the knowledge of the sales reps in the operating room. The transition to a repless model would force DePuy Synthes to downsize, reduce its selling costs, and change its whole structure. I do find it unlikely that this is going to occur across the board, however. Doctors and clinicians are very knowledgeable in the field, but asking them to learn the devices and their implementation is just not feasible. They are already required to do so much. Adding this to their plate would not have a positive outcome. You're going to open yourself up for potential negative outcomes if the device is put in wrong, but you're also going to have a disgruntled staff because you're asking them to do more and more and more for potentially less pay. Future business decisions will be affected if this outcome were to come to pass. A company like DePuy Synthes would most likely cut ties with hospitals that enter a repless model. The reps are in the OR to ensure the device is implanted properly. In order to do a repless model, DePuy Synthes would need to be released of liability if their reps could not be present in the operating room. I hate to say that, but we live in a sue-happy country, and I don't think this would ever happen. Unfortunately, that's just not going to work. If your device is defective, you're the one that's going to get sued. But if I'm creating and selling a medical device, I want to have my people in there to make sure it's at least put in the right way. If this came to pass, the competitors for DePuy Synthes, some big ones being Zimmer Biomet and Stryker, would be affected essentially the same way because their business models are very similar. Some competitors may be more willing to utilize a repless model for some hospitals, but I really don't see the major ones doing this. I think the hiring process for sales reps and the education of hospitals and doctors of the importance of these reps, it should be altered within the company's business model. I think that needs to be done a little bit better. It would be wise for DePuy Synthes to hire reps who have vast clinical knowledge. This is especially true of anatomical knowledge. It's one thing to teach a person a product, but knowledge of human anatomy takes some time. Hospitals and doctors also need to be educated not only in the importance of the rep, but also on their credibility. If hospitals and doctors understand the rep's background and knowledge, if they know that they have a clinical background, they're going to be less likely to have issues with the rep being in the operating room. And this ultimately comes down to communication. Reps should continue to gain knowledge through education. Whether that's advanced degrees, continuing education seminars, advanced level certifications, or conferences. You can't ever stop learning. You always got to learn something new. For personal note, I don't think it'd be wise to utilize a repless model from a lot of the things that I just said. I would have several questions for DePuy Synthes based on reading this. How will they ensure that their reps are appropriately educated and have a strong anatomical background? The argument could be, I can hire some people that have that, but what are the reps? What about the reps that are already employed? Right, it's not good form just to let those people go because you've raised the standard and expect them to operate differently. Is DePuy Synthes willing to incentivize reps to continue education? Will they pay for continuing education courses? Will high compensation be given to reps with advanced level degrees? If somebody takes the time to go and get their master's or their doctorate within the field, should they be compensated for that? How would DePuy Synthes educate doctors and hospitals of the importance of sales reps in the operating room? Would this be the responsibility of the sales rep or of the organization? Would DePuy Synthes help construct educational models to be utilized by the hospitals and doctors? Are they willing to create these to help further the business and help promote the use of their sales reps? A few more. What steps will DePuy Synthes do to ensure that the reps are successful over the competition in this changing environment? What are they going to do to give these reps a leg up? What will DePuy Synthes' response be to companies who choose to sell medical devices without the utilization of sales reps in the operating room? How are they going to respond? Are they going to follow suit? Are they going to be open and make it heard why they think that's a bad idea? Would DePuy Synthes consider the use of technology? Telemedicine. You're not necessarily in the operating room, but we live in the world of technology. We can FaceTime on an iPhone. And the nurse can hold it up for the doctor to see it, to assist physicians during that surgery without placing the reps in the operating room. The concern they're in the operating room, but we still need them. Would that be a feasible option? As you can see, I have some references. I've cited them all here. And then I've cited where my pictures came from here as well. Simply a picture of Barnes & Noble of the textbook and a picture of DePuy Synthes logo. Thank you.